Welcome to Spencer Hospital Health Talk. I am Rebecca, and today I'm joined by Dr. David Keith, who is Medical Director for Clay County Public Health and one of our outstanding emergency department physicians right here at Spencer Hospital. And that combination makes him perfect for today's topic, which is cold, flu, and other respiratory illnesses. So welcome, Dr. Keith.
Thanks for having me.
Well, thanks for being here. To get us started, tell us a little bit about your background and what led you to your current roles here at Spencer Hospital.
Well, I am currently an ER physician here at Spencer Hospital. I apologize to all my patients that I left recently in the hands of our new physicians here at Spencer, um, uh, the clinic at Spencer
Because
Hospital.
how many years were you a family?
12 years, yeah.
12 years. And I will tell all of our listeners, if you don't know, there were some people who were really sad to see you leave them as their family care provider.
The hardest decision of my career, but something that was felt very prompted for my family and some family time. So, but I did not want to leave our community, and I didn't feel like I needed to. So I chose the ER for the flexibility and the opportunity to serve. And so I still get to see my patients all the time. I still call them my patients because I know them well. But I currently serve as an ER physician, and I still do work at the hospital to be on call and to work as a hospitalist. And so I still keep a lot of my opportunities up to help serve our community any way I can. And I still work on the public health board of the Clay County um, uh, Public Health Board to be able to help further our total community health issues.
That is great. And then in terms of our topic today, cold, flu, respiratory illnesses, what are we seeing right now in terms of respiratory illnesses in our community?
Well, I think we are seeing some of the peaking we usually see a little bit later in the season. You can actually go to the Iowa Department of Health and they track these kind of things.
I get a weekly email about it.
You can look into it yourself and see what's going on. We're actually in a peak of influenza.
Here in the state of Iowa.
Here in the state of Iowa. And then it's been our experience from COVID and other seasons that we're usually 2 to 4 weeks, sometimes a little more behind the big city centers. So when Des Moines or Sioux Falls gets hit with a lot of influenza or COVID or things like that, we usually get it about a week or 2 to 3 weeks, 4 weeks later. And so I think even though the state is peaking, we're likely going to be getting our peak in the region. We have seen quite a bit of influenza in the last few weeks.
And there's more to come.
And there's more to come, yep. There are different kinds of influenza. I'll talk about that in a moment. The other things we're seeing, RSV, not very common. COVID is happening in its own little peak, but for it's a minor, compared to influenza, it's a minor cause of illness, respiratory issues. The other thing to realize is even though we often test for COVID, RSV, and influenza, that's our main test that we do for respiratory illness, because those are things we can do something about or guide or have consequences. There are many, many respiratory illnesses that we do not test for regularly. We have a panel we call the respiratory panel. It has anywhere from 12 to 20 different pathogens on it that are bacterial and viral, including parainfluenza, human metapneumo. There's adenoviruses and mycoplasma. There's a lot of different bugs that we don't test for regularly because it doesn't really change our management of them.
Oh, that's interesting. And did you just make up some of the names of those to sound fancy?
I didn't, but I do sound fancy sometimes.
When you say all those, it sounds really fancy.
No, but it's truly that we can't test for everything, and so sometimes people. Even this morning, I had a patient who I tested for respiratory illness who had symptoms for about a week or more, and she came back in because she wasn't feeling better. And I had retested her because she seemed to get better and got worse again, and one of those could have come back and gotten her. And so unfortunately, those were the 3 that we could do were negative, but I explained that you're still sick. I still believe you, of course, but there's nothing here I can do at the moment because everything else is looking okay.
Okay. Now tell us, what are some of the most common symptoms of the cold versus the flu, and how can people tell the difference?
Great question. So cold, upper respiratory illness as a category tend to be cough, congestion, runny nose, eye irritation. People say they get cold, and they're usually right. And it's mild. It doesn't mess up your day. You sneeze, you cough, you feel a little lousy, but generally you do well. You might even have sinus pressure, but it's not to the point where you have significant pain, fever. You usually just have mild symptoms. It's usually treatable by over-the-counter remedies, Tylenol, Motrin, some of the cough suppressants, which aren't fantastic, but they do sometimes help. But influenza is different. The people who have
Influenza is the flu, correct?
correct.
Okay.
When we say the flu, we generally mean influenza. There's also the stomach flu. We talked about having a stomach bug. But influenza, the disease, the pathogen, that it usually comes on rapidly, and you go from like 0 to 60 in hours. And so people say, like, this afternoon at lunch, I felt okay, but by the time I got home, I started feeling achy. I had a headache. Usually, have more systemic symptoms. There's more fatigue, body aches. You usually feel like somebody hit you with a truck. It's not always true. Everyone's different on how they respond to diseases, but generally, people with influenza have a more severe, more systemic like response to it.
Okay. So if you feel awful, it's
Yeah,
probably the flu.
and especially if it goes rapidly. That's been my observation over the years that it's
Oh.
like, a cold, like, oh, I have sniffles yesterday. Today I have a mild cough. Tomorrow I have a mild headache. That's usually a cold
Mm-hmm.
virus or something like that. Adenovirus. There are other coronaviruses that came before COVID-19 that do this to us. But really, the influenza, it hits you and it hits fast. And that's usually a telltale sign that you're dealing with influenza.
Okay. Now, for mild cold or flu symptoms, what are the best ways that we can care for ourselves at
Mm-hmm.
home? And that also includes rest,
Mm-hmm.
fluids, some of those over-the-counter
Right.
medications you talked about. What can we do to like help us on the road to recovery?
And that's really it. I mean, people talk about zinc and vitamin C and things like those things all in research tend to wash out. Um, everyone's tried some of those travel immunotherapy, drink the drink or eat the pills. Those have very little research that shows that they change a lot of outcomes. But will they harm you? No, not at all. And so it's pretty much rest, time, cough. Masking does help. I don't want to open up a controversy. I'm not trying to create something, but the best flu season we ever had the last 10 years was during COVID. Because we were masking for COVID, we prevented influenza and
Oh, so
other
we weren't
respiratory.
spreading those
Correct.
droplets to
That
people.
in other cultures like Japan and some other first world countries, they mask more frequently than we do as Americans, and so that it is an effective tool for receiving and preventing respiratory illness. So that is one way.
If you don't want to get sick, if you've got
Mhm.
things coming up and you're going to be
Mhm.
really busy and you have to go to the grocery store or
It
different
is
places like that,
effective.
it's okay just to throw a mask on.
Absolutely, it is effective, and we should make it more of a social norm and acceptable. And I see it more often now since COVID, and I hope that no one thinks less of someone or because and masking in airports is much more common. I see nowadays as I travel, and because it's for good reason. That is a place where we screen people for diseases coming in and out of our country and through airports, as well as it's a place where we can catch things. So masking is the number one. It truly does, and hand washing. So if you're traveling, if you're out and about, a little bottle of that
Hand
hand
sanitizer.
sanitizer is
Mm-hmm.
fantastic.
Yep.
Wash your hands often. When you're shaking hands with other people, today I just went and saw a patient in their home for hospice, and I made sure to wash my hands after I examined them, just to be safe for myself and for them. And so we just got to be mindful of those things. Those are the number one, and they truly do prevent. The research is strong. It's decades old. It really does help.
That's great. And it's easy.
And it's easy.
It's very easy.
And respectful, I think.
Yeah, I would agree.
Mm-hmm.
Now, are there certain symptoms that should raise a red flag that,
Yes.
you know what, this is a little bit beyond the
Correct.
mild symptoms?
Correct.
What are those symptoms and when should we get
So
help?
those are the kind of things that change your ability to take care of yourself or others. So some good examples are there are times where simple infections create significant problems. You can get a mild cold that could develop into pneumonia. Let's say you get RSV. For children, that's a big deal, especially for young children, less than 1 year of age and older. Once they're past 3 or 4, they usually can handle it quite well. But there are times where that disease can cause secondary infections, where you have bacterial infections or other issues. Sometimes you have a pneumonia, you think it's just a cold, and there's something more problematic happening. So the things I encourage patients to watch for is, are you feeling significantly worse in a way that your breathing is difficulty, you can't get around okay, and you feel so lethargic or so unwell? Now, can influenza do that? Absolutely. But an average healthy adult with rest and time, Tylenol, Motrin, and watching Netflix binging can usually get through that.
While drinking lots of water.
While drinking lots of water and taking care of yourself. But if it's more than that, like if you feel concerned and worried, I'd rather you be evaluated. And everyone's threshold is different. My threshold will be different than someone who works at one of our local businesses because I have expertise and experience. A lot of people call our medical people and their families. I started getting that my first year of medical school. Didn't know most of the things I was being asked, but that's what we're here for. Is we're here to serve each other. But truly, for me, my biggest worry is if you're feeling short of breath, you feel air hunger, you feel just so lousy you can't care for yourself, ask for help.
That's great advice. Now, somebody they feel like they're being strong, they're working through their symptoms, they're
Mm-hmm.
getting rest, they're doing all of that. How long should if the
Mm-hmm.
symptoms are like kind of like lingering for a long time,
Yeah.
how long should they wait before seeking help?
Great question. My rule of thumb when it comes to upper respiratory, including sinus infections, cold symptoms, flu like illness, if you can, quote, handle it, if things are going okay, you get through things, then I would suggest 7 to 10 days is the average. You should have a peak 5 to 10 days, or I'm sorry, 5 to 7 days out, and then it should be coming down. And as long as every day after that peak it's getting better, that's a good sign that your body's fighting it like it should. You're getting over it. Things are getting better. Then you're okay. But if that's not happening, if it's increasing after it, like I had a recent patient in the ER who felt better, saw her primary care physician. They evaluated her, checked for COVID, influenza, all were negative. She had a significant upper respiratory infection. And then she came in because I felt better for 2 days and then I got worse again. That's a reason to be evaluated because maybe there's something going on.
Oh.
And so I think it's dependent on your comfort level, your knowledge of your body, your symptoms, but if things are worsening and not improving after kind of halfway mark, I start to get concerned.
Yeah. And then when is it when and how is it appropriate to seek care?
Yeah.
Should you make an appointment with your primary care?
Mm-hmm.
Should you go to quick care over
Mm-hmm.
at the clinic?
Mm-hmm.
Should you come into the ER? Like, explain when you should go,
Right.
when you should utilize those
I think
different
that's
services.
a great question. So I'm going to work backwards for a minute. The emergency room is for emergencies. And what I mean by that is if you feel that you need immediate care to be evaluated for a significant symptom or concerning symptom, please come. That's what we're here for. And we see everybody and everything. If anyone walked in, we're gonna evaluate them and help them take care of them. Now, if you feel like I don't feel good but I'm okay, I would recommend you go to the urgent care, which is the next thing. It should be
Quick
open
care.
or quick care, yeah.
Here in our community, it's
yeah,
quick care.
Yeah, and here in our community, it's quick care, but it has different Instacare, urgent care. Um, those are all similar things. It just means that someone should be available during business hours, so you should call in or be able to walk in and be able to be seen. And that's for mild and moderate symptoms. You're like, I'm concerned, but I'm okay. I wouldn't need a hospital level of care of things and immediacy of major evaluations. And thankfully, our clinic here in Spencer is phenomenal because we have laboratory and X-ray, EKG, respiratory services. We have so many amazing services that many clinics don't have.
That's right.
That
all those tools are right at your fingertips.
Right there. So honestly, many times as a physician here in the community, in the clinic, I could work up people that immediately got admitted to the hospital because I could do a lot of things there. And just in fact, Dr. Robinson called me yesterday with a patient he evaluated in quick care. He decided I need them in the emergency room, called me right away, and Dr. Keith, hey, I have this patient, I need you back. And that patient was admitted. And so they can evaluate you and help you make that decision.
And depending on what's going on in the ER, sometimes there's a lot less wait times if you go through quick care.
Right. And then the step, because of quick care is within this Avera clinic, sometimes if you were my patient, I would always try to get you seen. And most of us doctors, that's our goal, to see our own people and our own patients. And if we can't, then we have quick care just for that reason. Mm-hmm. So I highly encourage you, if your symptoms are mild to moderate in nature, you're concerned, but you're okay, I would call the clinic because you can take care of the quick care and your personal physician if they can get you in right away. If it's evening time and things are moderate and you're doing okay, you can rest, you can breathe, then wait till the morning, call in. But again, the emergency room, there's 24/7, we're always there, we're always staffed. But realize, especially during this season, it can get busy. And thankfully, the hospital built a larger ER with better flow through. We have more privacy, more ability to help individual people with multiple issues, including larger trauma bays. I mean, I just can't brag enough about the ER. And it's not the reason why I changed jobs, but it is a wonderful perk. But it can get busy, and there are nights where we try our best, and we're 5 to 6 patients deep in the waiting room, and we do our best to get through them as quickly as possible. But I'm not trying to dissuade someone from using those services, but I want realize that community service has a limit to it. Unfortunately, here we only have so many beds, we only have so many staff, and so if you feel comfortable,
if you can wait,
that's what the first thing for me. And I have utilized ER for myself and my family here in Spencer, Iowa, because there's things that needed help. So that's one of my family members needed some mental health help. That was immediate in the evening, so we went to the ER. I shattered my leg and I couldn't wait. I told my wife I was going to wait till the morning. I did not do so. But
So there
my
are
first
emergency
my first thought
situations.
was, I'm going to call the orthos in the morning. I probably broke my ankle. I'll come home. No, I was in the ER. I got surgery that night.
Oh my.
So
Okay, just remind us.
yes,
What are a few of the symptoms that would be those red flags again?
yes,
Come to the ER.
it
Don't
would
wait
be
until morning.
significant breathing issues,
Okay.
particularly for children. Children are a little different, and the way I would tell you different is that children are the best thermometers for their illness. If you have a child who is I use the word lethargic. In the world of pediatrics, lethargic is a very strong, serious word. Lethargic child is one who's laying around, not interacting, not interested in the things around them. They want to cuddle in your lap and they won't play. They're not interested in anything around them. They're not interested in TV or candy or anything. That's a lethargic child. That is a serious issue. That needs to come. A child who's breathing quickly and can't slow it down. Children with RSV often have that symptom, and that's the telltale. They're working really hard to breathe. They can't eat. They can't nurse. They can't. That's concerning. So for children, let's start there. Breathing issues are my number one problem with kids and lethargy, where they're truly lethargic. If a kid's like sleeping in your arms, but he'll get up and he'll look at his sister and he'll go play for a little bit and come back and cuddle you, he's probably okay. Give him some Tylenol and Motrin. If they perk up after Tylenol and Motrin, they're usually okay. They really are. And then you call that at clinic in the morning and go see him. But a lethargic child that's just limp and just not going to do anything, that child needs to be evaluated, as well as one who's breathing and they're using their nostrils, their neck, their chest, their bellies. Those need to be seen, and those are serious. For adult young children, they usually have more of an ability to flex with that and tolerate that kind of thing. And if they're doing okay, Tylenol, a little Vicks vapor rub on their chest, and they're resting comfortably, they're probably going to be fine. Adults, again, it's breathing is one of my biggest worries when it comes to significant respiratory illness, because you're going to, if that fails because you're exhausted from the breathing quickly, if you're not moving enough oxygen, that's the reason to be seen. And you'll know when you just can't catch your breath, you can't breathe, or you're feeling so wiped and fatigued. Then let us evaluate you. That's what we're here for. And then fever. People come sometimes bringing themselves or their children for fever. Try treating it first always. I do get a few people who don't try Tylenol Motrin first. I've had it said to me many times, I wanted you to see the fever. Like, It's okay. I believe you. If your baby had 102 fever, give them Tylenol. I will believe you. I promise. And because if you give them Tylenol and they perk up, then you're treating them and they're going to do okay. And they can go to the clinic in the morning. We'll still see them, of course. We'll give them a full evaluation looking for those reasons. But do all the things at home that you can. And if after that you're not feeling well, you can't rest, you can't breathe well, you're feeling like some other symptoms that's concerning, particularly influenza, sometimes nausea and vomiting is just, you can't stop it. It becomes intractable, we call it in doctor terms. It just won't stop. That's what we're here for. So those are things I would look for.
Okay. Now, who are some of the people that might be at a higher risk for complications from flu or respiratory illnesses?
Great. As I mentioned, children, respiratory illness is one of my biggest worries, children under 1 particularly, because they can tucker out really quickly. And so watching those symptoms I described. I think anyone with a cardiovascular or pulmonary things, COPD, asthma, pulmonary fibrosis, and they generally know who they are, but like heart diseases that cause their heart to have to work harder than normal, heart failure, influenza and other respiratory illnesses can tip the scales of, if they're kind of on the edge, they're hanging in there, but they're not doing okay. That can sometimes tip the scale. Sometimes the inflammation of your lungs is so much you can't exchange oxygen as well as you want to. I had that recently this season, where a person had a respiratory illness, chronic respiratory illnesses, and they just kind of needed more help and had to come to the hospital and was admitted because they got some respiratory illness. It wasn't regular COVID, flu, RSV stuff, but it was something. And I could see it on chest X-ray. I couldn't identify it, but I got them admitted and taken care of. And they woke up with this symptom of shortness of breath and couldn't catch their breath.
Okay. Now, we've talked about what happens if you get the flu. What can you do to try to avoid the flu? What can you do to prevent flu and respiratory illnesses from
Mm-hmm.
spreading through our
Correct.
community?
As we talked about before, the number one is washing hands and masking. It truly is. It works. It's effective. Um, it's respectful. I think we forget that it's ripples in infectious disease ripple through our community. And so I highly recommend people who are sick to stay home. Ask your doctor for a note. That's what we're here for. Ask to work from home, um, and be able to get the help that you need when you need it, and so that you can recover and come back at full scope. And honestly, the other thing I've realized over the years, I've had pneumonia twice as a physician, and I was a young doctor. I can do this. I can work through it. I wore a mask. I took my antibiotics, but I didn't rest, and it took longer to recover because I pushed myself through it. I wore the mask. I washed my hands. I protected my patients. I took 24 hours, 40 hours of antibiotics, and then I went back to work. I should have rested a little longer, and
Because
maybe
it's harder to come back from
it
it.
is harder, and especially the older you get, and the more children you have, I think also is a factor. So the number one thing is you should focus on the things you can do firsthand. Second, immunizations work. I'm not opening a can of worms. It's one of the most, other than clean water, nothing has saved more human lives than immunizations. Nothing in the human history. And so those immunizations do work. Influenza vaccines are created 6 months to a year in advance as they're looking at the current trends and what they are. And generally speaking, our scientists are about 70% accurate, give or take, on figuring out the strains that are going to hurt us the most and hit us the most. And you have to understand that influenza changes, particularly influenza A. I didn't talk about this either, but I like to geek out about this stuff.
All right, go ahead and geek out.
Influenza
That's what a
A,
podcast is for.
yeah, influenza A is a zoonotic disease, meaning it comes from animals. It jumps to humans. We've heard this before. Influenza B isn't. It's usually human, and there's actually a C and a D. C doesn't do much to us. It's like a common cold. We don't even check for it.
Mm-hmm.
And D doesn't even cause disease that we know of, but it's around. It's kind of interesting.
Oh.
But A changes. So when you hear the H1N1 or the H3N2, those are descriptors of the influenza A envelope that tells us what kind of bug it is. And those have caused significant disease. In the last 150 years, we've had, I think, 6 to 8 major world pandemics. And you probably heard the phrase Spanish flu. That killed 40 million people in the world in the early 1900s. And so even though we have more advanced medicine than them, infectious disease still harms us. Immunizations do work, and particularly influenza, we prepare it every year, and we get a new one every year because it changes. Mm-hmm. COVID changes as well, but at a much slower rate. And so the COVID vaccine changes every 1 to 2 years, but the influenza has to change every year because of it. And so getting an appropriate immunization, and remember what it doesn't say that you'll never get the disease. It just means that your body's ready to fight when it shows up.
So hopefully it won't be as bad.
Correct. Yeah, and so you might have, instead of 5 to 7 days of symptoms, you might have 2 or 3 or less. And truly, it is an effective tool. I know there's going to be controversy about this, but the evidence is there, and it's good.
Now, you mentioned earlier that we're kind of hitting that peak. We're starting to hit that high point when it comes to flu.
Yeah.
Does that mean it's too late to get a vaccine? Or?
Not at all. You see, a vaccine takes about 2 weeks to kick in, meaning our bodies go through the process of receiving the vaccine. We feel crummy for 2 days, and I don't know how many times I get the flu every time I get the flu shot. You don't. You actually get an immune response. That shows me that your immune system is healthy. And that,
my immune system's very healthy because I was super achy after my flu shot this year.
But what happens is when you're making antibodies to protect...
I even canceled on a wine tasting because my body was so achy. I was like, you know what? I'm going to have to skip some fun tonight.
Well, and what's happening, though, is your body's spending a day making an army and making the factories to make the guns. Okay. And that's what's happening is to make any defense of our adaptive immune system, we have to build an army and we have to build weapons. That's our antibodies and our white blood cells that are targeted towards the immunization we get. Mm-hmm. That we have to fill that to do that.
All right.
So would you rather do it with the disease and doing it from 5 to 7 days?
No, I've got my army ready.
Right. And that's the whole point is you don't get the flu shot. It's inactive, it's dead. Same with the COVID vaccine. The same with almost all of our vaccines. Very few are live, what we call live. Live are attenuated, which means they're weakened, and very few of them are that way because we think that's the best way to make them work right.
Mm-hmm.
And so I recommend you get one. If it doesn't protect you, which it will, it'll also protect our community. And the more people who are immunized, the slower it can spread, the less people get very ill. And the other thing is, if I'm immunized but I catch influenza, I'm less likely to spread it to someone else
Okay.
because I'm already fighting it as it's building up my system. I'm already fighting it and I'm tempering it down. So I might have those 2 days that I feel crummy, but then I'm less likely to spread that disease to someone else.
Okay, that makes sense. That's very helpful. I'm going to circle back around.
Yep.
What advice do you have for people who feel sick
Mm-hmm.
but are unsure where to go for care
Mm-hmm.
and they don't want to overwhelm the ER?
Well, I think we talked about it a little
We
bit earlier.
touched the base on it, but I just feel like it's so important.
It is. I think your primary care team should be your quarterback. I really do. They can advise you, and I'm very comfortable when someone calls into their primary care and they said, they explain their symptoms to the nurse or the prod coordinator, and they say, we think you should go to the ER. That's what they're for. At least somebody with expertise
who knows you,
who knows you is advising you, because maybe you have COPD or heart disease, and then when you say, I feel so achy, I feel so sick, I can't care for myself, then your team's going, we know, Mrs. Smith. We think Mrs. Smith needs a higher level of care. Let's get him in, and that's totally reasonable. So the thing about being a primary care doctor that I miss the most is quarterbacking your health, is being that confidant, being the person who knows you and knows, oh, when Sally calls in and she's saying she's sick, she never calls in. She must be very sick. I know that because I know Sally,
Mm-hmm.
and so I can help make that decision of, I know that her son had strep last week. Maybe that's what's going on. That kind of in the know really helps benefit a family.
And I think that's why it's so important to have your regular physical and to have that ongoing conversation with your primary care provider.
It's relationship. My health provider, my personal physician, knows me, and he knows my health goals and what I want to do, and he can help me with that. And so I encourage people to have a relationship. I've seen patients who see me once every 5 years, and we laugh and chuckle, and they're healthy. That's great. But then what about those ones who I see every 5 years, but it's because I saw them in the ER and got them admitted for a significant disease. I hadn't seen them in 5 years. I don't know what their health is doing or how they're doing. And I love that. I personally love that relationship. And honestly, you come to this place to serve in medicine because you love relationships and you like taking care of people.
That's great. Okay, final message.
Yes.
What final message would you give us related to cold, flu, respiratory illnesses that we maybe haven't covered so far? And it's okay if you don't have anything, because I asked such great questions.
You do.
We maybe have covered it all.
We covered a lot. Honestly, the number one thing I would suggest is learn a little bit first how to take care of yourself. I kind of chuckle sometimes when I have young adults and I tell them about cough medicines over the counter, and I tell them about how to use Tylenol Motrin. They don't know sometimes. No one taught them. Mom gave them Tylenol and they moved on with their life.
Mm-hmm.
So I encourage you to look at that reasonable and appropriate websites for pediatrics. There's healthychildren.org. It's run by the American Academy of Pediatrics, all written by doctors, all fantastic data and information.
All based off of scientific facts.
Absolutely.
Research.
And it guides you. So sometimes when my patient would ask me a question about a child, and it was just like a little portal on the system, I would send back the webpage from the Healthy Children website, and it was fantastic. It said all the data there and tons of more. So make sure you're just up to date in those kind of things. I would encourage you that if you're feeling sick, take care of yourself by making sure you take the time off you need to. Get it. Knowing your doctor is a great way of also saying, hey, I'm sick today, may I have a note? And depending on that doctor's preference on how that goes, they might want to see you, which is totally reasonable.
Mm-hmm.
Because if you're not calling in but once a year and you're like, man, I'm really sick, well, please come in.
They don't know where you're at.
They don't know where you're at.
Yeah.
But I would stay home, take care of yourself, get the rest you need, and try to make sure you understand where your resources are. And truly, our clinic here is wonderful. I love serving in it. I think we try really hard to get patients where they need to be, and we have a full service clinic. I mean, I can't think of one more thing I'd put in that clinic that I couldn't get when I needed it for my patients, other than putting them in the hospital. And so truly, if you need something, the ER is great, but and I have everything, but truly the clinic has a lot. And so utilize the clinic. It's a great clinic. We have 3 brand new doctors that I love serving with. We have fantastic doctors who've been here for decades. We are truly blessed to have what we have here.
That's awesome. That's really great advice. Okay, now I don't let anyone leave
Okay.
without the final question.
The final question.
Final question. Are you prepared?
Is it personal?
No.
Okay. All right. Shoot.
No, this is about like health and wellness. Okay.
All right, great.
So I would like you to share one healthy living tip with us. So one
Okay.
little thing that people can take away with them. They
Mhm.
can easily pop it into their life, and all of a sudden things will be just a little bit better than they were the day before.
Oh, good question. I've got so many good ones that
Okay.
I personally work on. So I
You
would
can
say,
share two if you want.
okay, I'll share two. Number one, we underestimate the value of sleep. Please get plenty of sleep. There's so many cool resources and research coming out in sleep in the last 10 years. It is truly medicine for us. It is rest that allows us to maximize our abilities and our cognitive function and so on. It's definitely worth it. Number two, I really encourage people to move more. I am trying to move more. I am trying to exercise more because truly that is a key of our health that we put away because there's so many other things in the world. I like my phone just like anyone else, and so now I've learned to put my phone on my elliptical and watch my show as I'm doing 30 minutes of elliptical. And so those are two things I'd say. Number one, get plenty of sleep. It truly is important. Turn off the TV, put away the electronics, do what we call sleep hygiene tactics to get that good 8 hours of sleep. And second, move more and figure out what that means for you.
I started parking further away, so I have to walk a little further every
Yeah,
morning and
that's a
every
great
evening.
start. Yeah,
Yeah.
love it.
That's good. Okay. Well, those are great tips. Thank you so much for sharing your wealth of knowledge with us. I suspect we will have you back again sometime to talk about more great topics.
I'd be happy to.
And everyone, thank you so much for tuning in today. We hope that you learned a lot. We hope you don't get sick this season, but if you do, make sure you take care of yourself. Make sure you take care of your community. And we'll see you. Tune in for our next episode.
Have a great night.